Namaskar दोस्तों, I am Purnima from Fertility Dost. Good evening and welcome to yet another informative session. Informative के साथ साथ we can say that today we have a guest doctor with us, जो कि अगर हम कहें तो खुद में ही एक नाम है, खुद में ही एक शख्सियत है. She is a well-known lady, well-known specialist, and the number of awards, number of achievements, whole lot of list is there. So she had this list of achievements and the list of awards associated with her name, and I think the people in Pune must have interacted with her one or the other time of this journey when they are undergoing the fertility treatment. So today with we have Dr. Sunita. So today with her we'll discuss about the very complicated and new technologies associated with fertility and reproduction. So, the main topic for today's discussion is how to optimize fertility results. Yes, if you have any concerns related to your fertility, then please don't hesitate to post your comments. एंड हमेशा याद रखिए, अगर आपको लगता है कि आपको फेसबुक में सबके सामने आके अपने नाम से सवाल पूछने में कोई प्रॉब्लम है, देन प्लीज just message us on our official WhatsApp number and we'll ask your query as anonymous query. Don't worry about this. We'll take care of everything. And please don't leave the session in between, because today we are going to discuss very, very important topics with a very, very senior doctor. And for this session, I would really love to thank UNS, because UNS ने हमेशा हमारे लिए बहुत अच्छे डॉक्टर्स को लेकर आए हैं, and our community is continuously having this discussion with us that कि बहुत अच्छे डॉक्टर्स आ रहे हैं, हमें इतनी अच्छी इंफॉर्मेशन मिल रही है, and it really helps. So thank you UNS for providing such good doctors with us, such specialists all over the India. And let's start the session. And sorry for the delay viewers. And one more thing, very important thing, अगर आपके पास Facebook login नहीं है, you are not on the Facebook, then please don't worry. You can watch this live at your YouTube channel also, because यही वाला same जो live है वो आपको YouTube पे भी दिखेगा. इट्स नॉट दैट कि वहां पे आपको रिकॉर्डेड वर्जन जाएगा. सो प्लीज, एंड द व्यूअर्स हु आर इन आवर क्लोज्ड फेसबुक ग्रुप, दे कैन आल्सो वॉच दिस लाइव ओवर देयर. सो let's begin the session, and I'll call our guest doctor on the main screen, and let's start. Namaskar ma'am, good evening and welcome to Fertility Dost. So viewers, we have Dr. Sunita with us, and अगर आप पुणे में हैं तो आई थिंक आपको नाम से ही पता चल गया होगा कि हमारे मेन स्क्रीन पे कौन से डॉक्टर हैं. So with today with Dr. Sunita, we will discuss about the topic how to optimize fertility results. But before starting the session, let me introduce Dr. Sunita. So Dr. Sunita is the head of department and chief of IVF and Endoscopy Center, Ruby Hall, Pune. And she is the advisor and consultant at Dr. D.Y. Patil IVF and Endoscopy Center, Pune. And अगर हम कहें एक और नाम जोड़े तो she is a founder and medical director of Solo Clinic IVF, a center for excellence in infertility, Pune. So viewers, अगर आप पुणे में कहीं भी हैं and you really need to take a consultation with Dr. Sunita, please don't hesitate. You can visit any of the centers. She is also a founder and medical director of Solo Stem Cells. We are going to discuss about stem cell with Dr. Sunita. Really very interesting topic. We really want to know. And one very interesting thing that I really want to add in this session, that Dr. Sunita is the first doctor to have, we can say that her achievements in a way is in the form of first stem cell baby, and it's a world first at the age of 45. This is really a great achievement, Dr. Sunita, and I'm really thrilled I can say that whole Fertility Dost community is really thrilled to have you on our guest platform. Thank you, ma'am, for joining today. And if we just discuss about the achievements awards, I think list बहुत लंबी है, but हम कुछ कुछ चीजों में we can say that she's authored 8 books and 29 plus publications, 60 plus keynotes and 27 orations. That's a big number, big number. एंड डॉक्टर सुनीता के नाम पे बहुत सारे अवार्ड्स हैं, बहुत सारे अचीवमेंट्स हैं, और सबसे ज़्यादा जो मुझे खुद को अच्छा लगा दैट इज़ कि उनका वाइस शी हैज़ द अवार्ड एसोसिएटेड विद she has a letter of appreciation from the President of India. That is really a great achievement, ma'am. So, viewers, sorry, let's start the sessions. And one more thing, Dr. Sunita is the only doctor who is doing advanced laparoscopic treatment, that is keyhole laparoscopic treatment surgeries in Pune. And if you have any concerns related to us, this thing, please post your queries. आप सेशन में जरूर रहिएगा, आपकी हर क्वेरी को हम एड्रेस करेंगे. एंड इन केस आपको लगता है कि you really need to meet Dr. Sunita, just send us a message on our official number and you can directly go and visit doctor. So, Dr. Sunita, let's start with the sessions.
Only one
And
small correction. I,
Hanji.
I am the one who started the trend of advanced laparoscopic surgery way back in 1994. And now in India, there are many endoscopic surgeons and even in Pune who can do surgeries.
So you are the first one. You are the pioneer, we can say.
Yeah.
Yes. So, Dr. Sunita, आज का टाइम थोड़ा सा कम है because we are already delayed for the session. But obviously, we would really love to have you again and again on our platform so that our
We
viewers
decided,
can have.
we decided that third Wednesday of every month, I'll be with
Hmm.
you all for 7 o'clock, or we can start 7:30 to 8:30, because by the time I finish the work and all 7:30 to ho hi jate hai. Today also I have to leave the patient. So a third Wednesday of every month, let's say that we will be live at 7:30 p.m.
Done. Let's do this. And we finalized, we blocked the date for you, date, day, and time for you. Thank you so much, ma'am. Thank you.
Thank you.
So, Dr. Sunita, let's start with the session that how to optimize fertility results. Whenever we are in this fertility journey, we usually have many ups and lows. At times, failures are there, at times, achievements, positive results are there. But every time when there's negative result, the only one question is, ab kya? Now what to do? कैसे होगा, होगा भी कि नहीं होगा? So I really want to know your insight in such cases when everything seems to be perfect. We can say that gamete parts is perfect, the embryos are perfect, the uterus condition is perfect, but again the negative results. So what your advice for such patients, for such couples जिनको लगता है कि what next, अब क्या?
I'm getting a voice completely broken. Is it a problem at my end or your end?
Your voice is clear to me, ma'am. I can hear you properly. Can you hear me, Dr. Sunita?
Purnima, can you hear me?
Yes, ma'am. Perfect. Your voice is perfect. Yes.
Oh, in between, I think 30 seconds, I unfortunately could not hear your question at all. We had, I
I'll
don't know if
repeat.
it was with me or with you.
I'll
So,
repeat. I'll repeat.
just in
I'll
one line, if you can repeat.
Right. So I really want to know that when the failure is there for a couple in this fertility journey and everything seems good, embryos are good, uterus are good, but the result shows negative, then what could be the your advice to such patients that how to proceed further?
Okay, so you are directly asking me about the IVF infertility, IVF failure,
Right.
and
Right.
what they have. See, you know what? First of all, IVF is not 100% success. What is very, very important is there are many variables which can affect your result. Age of a lady, her egg reservoir, her uterus, her condition, and her cause why pregnancy was not happening. Was it a tuberculosis? Was it the fibroids in the uterus? Was it the polycystic ovaries? So, what was the cause depending upon which the results can succeed? Now, many a times that they have not taken a adequate treatment from a very expert ART lab. It may be because of that, or it may be that one of the gamete, either egg or the sperm, is at fault, or the uterus is at fault, and that may be the reason. So, what is very important is what I do in my practice is I don't allow the failure. Even before the failure happens, I sit with the patient with their history. What is her age? What is her egg quality? What is her husband's sperm quality? On sonography, what is the uterus, the womb I'm looking at is seen, and what is her subfertility cause? So I work on. Now there are two important things you need to have at any cost is excellent good quality embryos, and you need to have an excellent uterus. Now, if these both are there, then the dialogue between the embryo and the uterine lining has to happen. Now, in some patient, if they say it is a repeated failure, then I cross-check, is there any problem in the uterus, in the womb from inside? We can do endoscopy, we can do transvaginal sonography. And even if that is normal and stiff failure is happening, there are tests nowadays where you can have the certain day of a menses or certain day after the progesterone when the embryo should be transferred. You know what? When the natural pregnancy happens, it is so easy for a couple to conceive. They don't even come to know unless they miss the period that there is a live baby growing inside her body. But when it happens in the lab, there are so many complex mechanisms which are involved in the process of implantation. So ये embryo जब चिपकता है यूट्राइन कैविटी को, इसकी प्रक्रिया ये सिर्फ 24 घंटे के अंदर ही चिपकता है. आप वो 24 घंटे का विंडो छोड़ दिया, आप 3 दिन के बाद डाला या 2 दिन पहले डाला, तो embryo will not implant. In some women, the implantation window can be 72 hours, but in some women, it can be as narrow as 8 hours, 10 hours. So we have to find that the timing of putting this embryo is also important. Even if my laboratory says excellent embryo, the lining of the lady is also very good, but the procedure with which I'm doing is also equally important. So it has to be atraumatic, very smooth, very safely. So you should be studying the passage of a lady one cycle before, in which direction, how much centimeter I need to go in, then when should I do the change in my direction, so that I will not hit and I will not cause bleeding or I will not cause trauma. All these factors are important. And Purnima, to tell you the truth, sometimes it's beyond the human. So I
Right.
believe in spiritual power. So when we start the embryo transfer, I ask the patient which God you believe in. She says, I believe in Ganpati. I said, you start Ganpati Stotra. And my entire team, with their own God, we start our prayers. We all know that sometimes the prayer work, and that's why God bless me. My results are amazing. I don't know whether it is me, my team, my embryologist, our knowledge, our understanding, the study which we do in a depth. I never give patient 2 minutes. I sit with her for 20 minutes, 10 minutes, understand everything, and then only I can proceed with this. Or sometimes it is just the prayers which are working, because I'm a spiritual person and I believe that where the human cannot work, the God will definitely work.
Right. Right. बिल्कुल, आई टोटली एग्री विद यू ऑन दैट. कुछ चीज़ें हैं जो हमारे हाथ में नहीं हैं. But again, Dr. Sunita, doctor is God for
But
us.
it cannot replace the God. It is next to the God. It cannot replace God.
Right, right, right. Right. Dr. Sunita, I would really love to have some insight in this stem cell therapy because this is the latest
Before we go for
procedure.
stem cell, can I say one more thing to people, because there is huge crowd, they are listening. You know what? Sometimes it may be the doctors and their lab. It may not be very standard, because in India now the AOT law is coming. But otherwise,
Mhm.
anyone, even with the 10 days training, can start the IVF, which has to stop. And I'm very happy that government has taken an initiative and the law comes. It who will be doing IVF, what are the facilities you should have in IVF. It is very important, because patient doesn't understand. They don't go, they just go on
Mhm.
advertisements which they see on a Google popping up, and they just follow. So very important that everyone who is visiting and who is going for a IVF treatment, they should know the details about the doctor, how many years they have, what is the embryologist who is working on the lab, how many embryologists they have, what are the laboratory facilities, how frequently they upgrade. All these matter. I feel so sorry sometimes that even if you go for a dinner in the hotel, you study the hotel, review कैसा है, उसमें क्या क्या मिलता है, quality कैसी है, food अच्छा है ना. अरे when you are choosing the doctor, then it is a very important that you study that doctor and don't get carried away with the advertise. Number one. Number two is, many a times what happens, the fertility is not a couple problem. It becomes a family issue, a family
Right.
problem. And then one mother-in-law's daughter's friend, she suggests, नहीं नहीं, मैंने ये आयुर्वेदिक ट्रीटमेंट ली थी, मैंने ये भोले बाबा के पास गई थी, उन्होंने ये अंगारा दिया, उन्होंने 5 शुक्रवार किए. ये 4 साल तो आप उसमें ही वेस्ट करते हो, भोले बाबा को और अंगारा लगा के. I do believe in spirituality, but spirituality with the science is important, not the blind spirituality taking angara from somewhere and putting it. The embryos are not made, or pregnancies are not made like that. But what is important, the earlier you start the treatment, younger
Hmm.
your age, better are the results of a IVF. So
Right.
if 1 year of a marriage you are not conceiving and you are below 35 years, then you should be meeting the expert gynecologist or the infertility specialist who can give you simple treatment and make you conceive. Rather, you reach to the infertility specialist or a IVF consultant after the age of 35 or 37, when she has no choice than to take you directly for a IVF treatment. So 1 year of marriage, an unprotected relationship, or 6 months of a marriage above the age of 35, but pregnancy has not happened, please meet the expert in infertility to find out the cause. It may be sometimes infections, sometimes your timing of a relations is gone wrong, sometimes there may be a small tumor in the uterus which you can remove at early stage and give a natural pregnancy as well.
Right, right. So we emphasize on this important factor that please choose a right doctor at right time. This is really important.
At right time.
Right. And for this viewers, we also have doctor matching services with us. If you really want to select right doctor at right time in your city, do let us know. Connect with us. So, Dr. Sunita, next we really want to have some insight in this stem cell therapy. Is it really beneficial? And we can say that you are the pioneer in this treatment. So, please, few details or insight on this.
Yeah, Purnima, stem cell is under research. In
Hmm.
India, we have a ICMR. The ICMR is a central body by the government, and ICMR decide who should be giving the treatment of stem cell and for what diseases. Now, for
Okay.
example, anyone has a blood cancer, okay?
Mm-hmm.
The therapy is established and is permitted by the government. But the stem cell therapy in infertility is still labeled as under research. What
Okay.
happens is, stem cell has a capacity to grow into any organ which we transfer into. A decade down, 10 years down the line, I know when the scientists and the clinician will meet together and they will
Hmm.
do lot of research activity. The ICMR will increase their inclusion criteria for stem cell therapy. But as if now, infertility, any treatment is under research. Now, why it
Okay.
is under research? Because it doesn't work in the same way for all the patient. So at
Okay.
present with me, I'm the only one in India where DCGI, Drug Control of India, has given me a permission to do the clinical trials for a stem cells in female infertility. So there are two types of a patients we can work on that. One is the
Hmm.
one where ovaries are exhausted with the egg reserve. Their
Okay.
AMH value has gone very down. It may be because of the age factor, or it may
Hmm.
be because of certain other problems they faced. It may be the lifestyle, smoking, alcohol, the pollution in which we are working, the stress which we are working, the electromagnetic waves which are coming from the every digital instrument, whether it is a laptop, whether it is a phone, whether it is an iPad, all is affecting your body. We are not understanding. 4 साल का बच्चा भी दिन भर वीडियो पे खेलता है. I feel so bad. You never know when he will become an adult or she will become an adult, what is going to happen with their genital system. Is it going to cause a damage to their gonads? This is very, very serious problem. But
Right.
whatever said and done, or it may be the lady has undergone some treatment or a surgery on the ovaries, like she had an ovarian cyst or the tumor. So when the surgery happens, what happened is half the ovary has gone out, and
Right. Right.
why a reservoir is less. So we took a DCGI and Pune FDA permission I have to do the stem cells for a clinical trial. But we tell all the patient that this is a trial. It may work, it may not work. So if they
Hmm.
enroll themselves into the trial voluntarily, we are taking. Now there are certain patients whom we got the results. I must say there are at least 15 to 20 patients where I gave them a pregnancies. Now the problem here was why this is so, because even in our 20 case studies, in 65% we got the results and in 35% we did not got the result. When you don't have an explanation, don't have this, we call it that it is still under research. So one, for ovarian regeneration, stem cell has a property to regenerate in any organ we put them into. So there is so much research going on across the globe. Even Narendra Modi ji has visited to eradicate the stem with the stem cell therapy, the sickle cell in certain Kutch area of Gujarat. There is a huge
Hmm.
work going on across the globe and even in India. What is important is the scientists don't have patient, they do it on animals. The clinician have patient, but they don't have a knowledge about it.
Right.
Fortunately, it is for some other degenerative diseases. I studied stem cells in 2015, and then I came to know after a year or so the property of stem cell of regeneration. And this was a scientist from Dubai who flew down, and she asked for doing a stem cell as a research purpose. She said, I'm 45, so please do it. I said, no, I cannot take you because it is not established therapy. She said, I'm aware, I'm ready to enroll myself into your pilot study. And that's how we took it. And successfully, we took out one egg and then two eggs, and we got an embryo. We gave her a pregnancy. On 16th April this year, the baby completed 4 years. She came and met me also. Beautiful
Hmm.
baby. Now, the thing is, how ovaries are exhausted, even the womb of the uterus, the lining of the uterus can undergo infection. Tuberculosis is still very common and it
Right.
affects the lining. So the womb cannot come in. And that's why they cannot. Now the surrogacy law came in. So the ladies have to work on their own womb because surrogacy is as good as gone from India. So
Right.
where also we can put the stem cell, and that is also India's first stem cell baby. I have published in last 1 month ago only. So here, what happened is I was asked by the journal to write a review article. Now, when what do you mean by review article? You study all world research people. And then when I studied all 10 years publication, I came to know everyone in the world was working below the age of 40, and mine was at the 45. And that's how we got a world record to do at 45, giving not only India's first baby, but the world's first baby. And now
Wow.
we, with the experience, we have now become quite common or expert. And I am sure one day I'll be able to convince the government that they can select which lab to do, but it should be offering to many more needy couple. Stem
Right.
cells are here one day, a decade down. Stem cells and gene therapy may revolutionize the way we look at the medicine today.
Right, and it is really going to help like many of the couples because we really want a kid of our own. That's the
Oh,
main important thing.
very true. Very true.
Right, right, right. Dr. Sunita, in the beginning also we talked about laparoscopy. So you just mentioned that you started that keyhole laparoscopy. So what exactly is the importance and how this is the most advanced technology which you are using or the doctors are using today?
Yeah. So, Purnima, this is very important. And my appeal to all viewers, all benign surgeries in the body, may it be gallbladder, may it be appendix, may it be uterus removal, may it be a fibroid tumor removal, please don't undergo open surgery. Keyhole surgery means we just take a 5 millimeter holes on your body. The machineries goes in, the camera goes in, we see on the TV screen entire pathology 40 times more magnified maybe, and we do the surgery completely laparoscopically. The advantage of this minimal invasive surgery is patient comes in the morning and goes off in the evening without the pathology in their body. So this is a miracle. Way back in 1994, when I came first time in the city of Pune, I started the trend of laparoscopic hysterectomy. As usual, when you start doing something, there will be some criticism, but you keep on doing the work, and then one day the whole world will follow you. And we were at least 7 to 8 pioneers in the country way back in 91 to 95. In every state, there were 1 to 2 people who started doing this surgery, and now every city has hundreds of endoscopic surgeons. I'm proud to say India has a fantastic young generation of an endoscopic surgeon. So please, laparoscopy is here to stay. There are many pathologies. Suppose, Purnima, your uterus has one tumor inside. You come in the morning, I do endoscopically, I remove the tumor, and I send you back in the evening. You can go for a party in the evening. Why not? This is this. So it is very important. Just now, I have a patient who has come from Bhopal. She was in Texas. She had undergone for a small 12 centimeter tumor, a open surgery. She has such a big scar. Now her uterus tubes, everything is stuck. And now she is here to me for the IVF because one failure in Bhopal. But the pain, the seeing such a big scar. So don't think your white skin is a better skin. In India, we have even the smaller places. I have my friends even in Latur and Shirdi doing amazing endoscopic surgeries. So I was the pioneer in Pune. I was the president of this organization in 2019 and 20, where I motivated even in all medical colleges in India the project called Eagle. Every aspiring gynecologist should learn laparoscopy. So this was the Eagle project which is going on in medical colleges, and every now the resident or the doctors who pass out from the government colleges also should be expert. So they go out and they start doing this keyhole surgery. alone Dr. Sunita sitting in Pune cannot help the patient from Jammu. But the Jammu gynecologist is expert in
Right.
endoscopic surgeon. She can help. So we are training thousands and thousands of doctors across the country by all of us. And the keyhole surgery, laparoscopic surgery, if you want to remove the uterus, why you want to open, why you want to remain in a bed for 5 days, why you want to be on a rest for 3 months, just do the keyhole surgery. Within a week you start driving, you can start going to your offices, you can enjoy, so you don't feel like a diseased lady or a patient. No one likes to be bimar, and nowadays you have a nuclear family, there is no one to take care
Right.
of you or your kids. So it's very important. I appeal to everyone, whether it is urology, whether it is gynecology, whether it is a general surgery, you should go. And believe me, 80% of oncosurgeons in India are doing even the laparoscopic surgeries, whichever the cancer surgeries are allowed to be done by keyhole. There are certain surgeries which are not indicated, or if they are in advanced stage, they cannot do. But many, when it is a stage 1, they can still do laparoscopic surgeries. So
Right.
laparoscopic surgery, we have a patients coming from all across the globe for laparoscopic surgery. And I feel so painful that if patient from San Francisco coming all the way for laparoscopic surgery to Pune, there's no need. They should be finding the great endoscopic surgeon in their city. And if you feel it is complicated and if you can afford, then you are more than welcome.
Right, right, right. So we can say that yes, please look for the options. It's really necessary to just talk to your doctor, just have a friendly conversation with your doctor so that the doctor can guide you properly and you can obviously take the advantage of new technologies.
There
Dr.
are
Sunita
many
here.
doctors also, Purnima,
Hmm.
where they refer you the case. Sunita, this case is very complicated.
Hmm, hmm,
He
hmm.
or she may be a laparoscopic surgeon, but I think this is the case you should be handling. So even doctors are always caring for the patient. It's not like that.
Right, right,
So
right,
I
right.
ask some question on embryo, which has been.
Right, right. I'll just highlight this. Does embryoscope technology helps in optimizing embryo quality and what is the cost of it?
Okay, so definitely, beta, these advanced technology, I do have at DY Patil Pimpri Chinchwad Pune, where I have the best in the world, which is possible. It is there, whether it is a laser, whether it is an embryoscope or anything. And because it is embryoscope is into the university recognized center, the cost is absolutely peanut. It may be around
Hmm.
5,000 rupees also, but the embryoscope as such is a 1 CR plus the machinery. Now, how it helps? It is whether I use it for all the patient. No, probably it will be too much load on the system because the amount of work. But those cases which are elderly, those who have repeated IVF failure, where I feel egg and sperm quality, maybe I need to see them, then this embryoscope does 24 by 7 video recording of those embryos. And then we can sit across on our computer and see how these embryos are. And then out of many embryos, we can select which is the best. Across the globe, the quality of the embryo is decided mainly by its morphology. And embryoscope helps me to decide. Also, there is a rule. The embryo, when we make, at 24 hours, it should be 2 cell. At 48 hours, it should be 4 cell. At 72 hours, it should be 8 cell. Now, if at 48 hours, when it is supposed to be 4 cell, if it is already 8 cell, I'm going to discard that embryo because it is not genetically healthy. Or at 48 hours, if it is lagging behind only 2 cell, then also it is not healthy. So indirectly, embryoscope do help me to analyze the genetic status of the embryo also. Around 80% of the time, we can say with the embryoscope whether it is genetically healthy and robust embryo. You can go online on my Facebook wall, somewhere at Solo Clinic page. There is a huge lecture on preconceptional genetics testing, where we take even the genetic studies without taking a biopsy. only on the fluid in which we grow the embryo. You can have the genetic material coming into that fluid, and that fluid can be done for a genetics testing, and you can select whether embryo is genetically normal or not. So there are so many advances on Solo Clinic page. If you go Solo Clinic IVF, you will be able to see preconceptional Phytopanishad conference. I have given this 30 minutes oration.
Right. So, viewers, please do check the Solo Clinic page as Dr. Sunita mentioned. And if you have any queries, as Dr. Sunita mentioned, that she'll be visiting our platform every Wednesday for you all. So, start collecting your questions, start working on your inner part, whatever you want to ask her, you can. So, Dr. Sunita, is this embryoscope technology is like every clinic is using this, or it is on demand only?
I think in Maharashtra, we are the only probably two centers in Maharashtra who has this. As I said, it's very expensive, and then patient may not afford the cost, because at DPU it is a university recognized where we work no profit, no loss. So we are not charging the patient for embryoscope. But if I would have got my own private center, I cannot afford to do it free of cost.
Right. Right.
So all India, maybe hardly 10, 12 centers may be there who has this
Mhm.
embryos. But if
Okay,
you have
right.
a complicated case, recurrent implantation failure case, naturally you should be going to the centers where all these advanced technologies are there.
Right, right. Understood. Dr. Sunita, one last question, I would say, because it's
Seven.
almost 8. So we'll definitely we'll ask more questions on coming sessions. So, Dr. Sunita, usually when we have recurrent implantation failures, doctors mostly advise us to do hysteroscopy. What exactly is the purpose of this hysteroscopy, or is it really necessary to do hysteroscopy before embryo transfer?
I will say do hysteroscopy before transfer, before you fail. Because when you fail, you lose your
Mhm.
embryos. You have taken n number of injections, tablets. They are also expensive. And every failure is an emotional, economical, and physical trauma for a couple.
Right.
So it takes so many injections. So in hysteroscopy, we examine the womb. In a simple sentence, if I have to say, ask you, Purnima, if you want to buy a house, will you just buy by doing its, seeing its pictures on any computer? No. You would like
No.
to go inside. You will see whether I am comfortable in this house. Same way that hysteroscopy is examination of your womb from inside. It is the
Mm.
house of a baby. It's very important that the clinician goes inside, checks everything. Are there anything, even the signs of endometritis, infections, which otherwise
Mm.
patient don't have a complaint, but we can see micropolyposis. And I know this patient has an infection, chronic infection. I would like to treat that infection before I do the embryo transfer, so that the infection will not cause rejection of these embryos. So it's very
Right.
important. Also, as I said, embryo transfer is a very delicate procedure. By doing a office hysteroscopy, we do even the trial transfer. एक रिहर्सल करते हैं. आप शादी में डांस भी करना चाहते हो तो 15 दिन पहले रिहर्सल करते हो.
Right.
जहाँ तो हम एम्ब्रियो ट्रांसफर एक डेलिकेट प्रोसीजर कर रहे हैं. So it's like a trial transfer we do in the same sitting, in which direction I'll go, so that it will become a traumatic fluent. I know everything about the patient. So hysteroscopy prior to your IVF, if your fertility consultant is advising, please undergo. Now 3D sonography can sometimes in 10 to 15% of the cases still can miss the pathology. Sonography has
Mm.
its own limitation. So going inside and watching the womb is very, very important. If I'm watching Purnima, for example, one patient, maybe because of the male factor, I'm taking her for a IVF. And when I go in and I see her, both the tubes were blocked, I will be shocked. Before doing the embryo transfer, I'll start thinking why her tubes are
Right.
blocked. What is her infection? Have I treated her infection? If not, that infection will not give me. I cannot just blindly say, oh, male factor tha, maine male factor se to embryo bana liya. I also need to see the womb of the lady. So egg, sperm and the womb, all three has to be optimized. Her hormones has to be optimized if you want to give good results to your patients.
Right, right. Understood. And it's really important that you should do the things, or you should proceed further step by step, because it will
Yes.
not help if you start jumping, or we can say that start missing the steps.
For women,
Dr.
simple
Sumita?
thing like obesity. Patient
Mhm.
comes with a 90 kg in my cabin. Polycystic, ma'am, I'm exhausted. Take me for IVF. I don't rush unless she reduces minimum 10% of her weight loss. What happens, patient is frustrated. She will go to the
Right.
other doctor. I know 100% she will fail and then she come back to me because then she learn with the hard way. It's very important. Listen to your doctor. Take weight loss seriously. Diet, exercise, weight loss plays a very important role, not only in preconceptional phase, but even during pregnancy to make it
Pregnancy.
smooth ride for the baby.
Right, right, right. And that's why we advise our viewers, our community, to please work on your body parameters. It is really important. It's not just that working on your reproductive system will help, working on your body, internal body parameters also helps. And viewers, if you want to have another query related to weight loss, nutrition, do let us know. Our official number is flashing on the screen. Please send us a message. We have very amazing in-house programs for you. Dr. Sunita, I know time come here, but last question I'll take. So this is a query from our closed Facebook group, and she messaged, "Please suggest me what should be the course of next steps, as I just faced implantation failure." So, what are the steps you suggest in general for a patient?
So difficult question she's asking because only the consultant who is managing her should know. But Bacha, just first of all, thank you. And my emotion and sympathy, everything with you. It is so difficult when you face the failure after ART, you feel the word has come. First of all, be relaxed. Stress itself can affect your result. Second thing is, baby is part of your life. Baby is not your complete life. Every day in your life is important, so relax. Take it easy. God will give you maybe some time. Third important thing is check with yourself what is your age, what was your AMH, what was your egg quality, whether your stimulation protocols were good, whether your monitoring happened very well, whether your embryologist where you have done, they were trained embryologist, whether you got an opportunity to sit with the embryologist and talk to with them, what was your cause of IVF, why you needed IVF. So whether the basic pathology, you had a fibroid, you have a polycystic ovaries, you have endometriosis, you have a male factor, sperms were very bad, whether they were taken care of, whether your uterine cavity was checked. And if all this was perfectly checked, then you start working on your endometrial receptivity. As I said in the beginning, find out your implantation window and try to do your transfer with the remaining embryos in implantation failure. But first of all, check the quality standard of the labs where you have done the IVF. It's very important for us.
Very important, right? We usually, I think, in the beginning, you just mentioned about Google reviews and all that, and we do
Google
agree
reviews
with
is
that.
one part because there the successful people will send you Google review. Yesterday, my patient said you have 1,500 reviews, ma'am, and that's why we came. So that's okay. That is the truth patient has written. But the advertises which pops up so much by
Yeah.
this thing. So try to understand how many years these ART consultants are working there. How are their lab standard? What are the machineries? You should have the video of your center where you are going so that you see all the machineries are there. But don't read too much of a Google and ask your doctor too much of a Google question because Google can misguide. Who writes on Google is also equally important.
Right. Totally agreed with you. And viewers, please, if you have missed anything or you have missed the beginning of the session, ये सेशन यहीं पे इसी लिंक पे सेव्ड है, इसको प्लीज दोबारा देखिएगा. यूट्यूब पे भी ये सेव्ड रहेगा. और इन केस you have any friend, relative, any colleague who is undergoing this issue, this medical concern, please connect that lady, that couple with us, and आप ये share जरूर कीजिए, because you know at times these little sharing, these little things helps a lot, because fertility journey is a journey where we usually don't want to discuss the things in open. It is really inside matter, and we as a host prefer that please come to us and talk to us and discuss to us. And for Dr. Sunita, I would say that next Wednesday we'll definitely going to meet her again. So
Third Wednesday. Third
third.
Wednesday of next month.
ओके फाइन, थर्ड वेडनेसडे ऑफ नेक्स्ट मंथ. तब तक आप अपने क्वेश्चंस, अपने सवाल, अपनी क्वेरीज जमा करते रहिए. और अगर हो सके तो जस्ट स्टार्ट सेंडिंग अस योर क्वेरीज सो दैट वी कैन हैव अ गुड सेशन. एंड ऑब्वियसली वी डोंट वांट यू कि आप बैठे रहें और आपके सवालों के जवाब हम ना दे पाए. विल डेफिनेटली प्लान अ गुड सेशन, विल स्टार्ट एट टाइम, और आपके हर सवाल का जवाब हम जरूर देंगे. एंड डॉक्टर सुनीता, थैंक यू सो मच फॉर ज्वाइनिंग. आई नो आपको भी एकदम से भाग के क्लिनिक पे से आना पड़ा फॉर दिस सेशन, एंड बट इट्स रियली नाइस. इट्स, आई कैन से दैट मुझे ऐसा लगा ही नहीं कि मैं आपसे पहली बार बात कर रही हूँ. आपने इतने अच्छे से बहुत छोटी छोटी चीजें समझाई जो कि यूजली वी एज अ लेमैन, एज अ कॉमन पर्सन, वी डोंट अंडरस्टैंड. बट आपने जिस तरीके से बोला, इट्स रियली नाइस कि हाँ, हमें हर चीज समझ आई. एंड सबसे अच्छी बात कि हमारे लिए क्या जरूरी है, हमें क्या करना चाहिए. दिस इज रियली important. And once again, thank you, Dr. Sunita. Thank you, UNS, for arranging this session. And ma'am, we would really love to have you again on our platform. Thank you
Thank
for
you.
listening.
My pleasure. Thank you. Thank you.
Thank you. Thank you. Bye bye.